Hello, chiropractors, slayers of subluxation, unleashers of the imprisoned impulse. I am Dr. Anthony Pellegrino from ChiroEdge, and welcome to the Chiropractic Research Breakdown, where each down we break down the most relevant chiropractic science and philosophy to empower you with the ammo and certainty needed to change your community from the inside out. This is going to be a really good one today. We're going to be talking about two different articles from the Chiropractic Journal of Australia, a case series on quality of life in elderly, a case report on the neuropathy in an 18-year-old cricketer, and we're also going to be looking at medical doctors from the journal Spine Deformity and what they say about how scoliosis relates to, specifically adolescent idiopathic scoliosis, relates to mental health issues and psychological conditions in children. Huge. As always, you can get a free trial of our premier ChiroEdge service at ChiroEdgeMedia.com, where we take these very research articles that you'll hear us talk about today, and we put it into patient digestible newsletters with all of your branding on it, and we deliver it to you each and every week for you to stimulate the proper questions, stimulate referrals, and stimulate, well, your own certainty and therefore retention in your practice. You can get that service, that premier service, at ChiroEdgeMedia.com, where it's all that information is branded to you. Or you can also go to that same website and get a free trial of the service. All right, here we go. All right, the first study that we're going to go over today is called Changes in Quality of Life in 4 Older Adult Patients Receiving Manual Chiropractic Care for the Correction of Vertebral Subluxation, a case series. Now, I really like this study for a few different reasons. This is actually done by an intern who is the New Zealand College of Chiropractic, and all he did was he took all of his older adult patients, and it'd be over the age of 60, and you could do this for any patient population. He took all of his patients and he looked at his SF36 scores, which, if you guys have gone through chiropractic college, maybe using your own practice, is a great tool for measuring quality of life changes under different, whatever you're doing. It could be for medications, it could be for acupuncture, it could be for therapies, it could be for whatever. In this case, obviously, we're looking at chiropractic care. So he took all of his patients and he said, I'm taking care of these guys anyway. I have to do these SF36s for clinic. Why don't I just make a paper out of it? So he took it and he analyzed all of it and he utilized all this change and he wrote a paper. It's nice and easy. It's 6 pages. The thing I love about this is that any student can do this. You have this data, right? You have this. You can make something impactful. You can put your name on a paper. This is published specifically out of the Chiropractic Journal of Australia, which is good. It's always coming out with great stuff. So you can do this in clinic, in practice. If you want to look at it not just for quality of life, but if you want to look at it for autism, you can use the Autism Treatment Evaluation Checklist from the Autism Research Institute out of San Diego. I believe that's ari.org. It's free. You can use that, download the PDF. If you want to look at depression, just go download the PDF for the Beck Depression Inventory. They also have a Beck Anxiety Inventory. Whatever it is that you want to know more about and demonstrate the efficacy of what you do, just get an inventory, give it to your practice members or your patients at reevaluations, and then publish. It's nice and easy. So this is Changes in Quality of Life for 4 older adult patients. So notable things that he mentions right in the introduction, he talks about the role of chiropractic care. He says the primary objective of chiropractic care is to improve spinal function in order to either improve nervous system function and general health and or prevent or manage neuromusculoskeletal conditions. I love the and or there. Depends on what college you're at. Depends on what state you're at, whether or not you can say that. It's funny. Chiropractors achieve this through assessment and correction of areas of the spine that have been traditionally referred to as vertebral subluxation, also referred to as spinal dysfunction in the chiropractic literature. I don't like that, but whatever. All right. So they go ahead, and I didn't know this, but the Australian Spinal Research Foundation has developed a conceptual definition of vertebral subluxation. It states, a vertebral subluxation is a diminished state of being comprising of a state of reduced coherence, altered biomechanical function, altered neurological function, and altered adaptability. Now, I love that definition. I'm going to go ahead and read it again. A vertebral subluxation is a diminished state of being comprising of a state of reduced coherence, altered biomechanical function, altered neurological function, and altered adaptability. Absolutely. All right. So what this guy did was he looked at his public patients over the age of 60. He managed them at the New Zealand Chiropractic College teaching clinic over 18 months with what they referred to as diversified and Gonstead care. So what he does talk about, though, is the fact that he did use a scope on majority of patients. His average adjustment is 0 to 3. It ranged from 0 to 3 segments per visit, which I love. I love, right? Valuing the specificity of care there versus just moving a bunch of things and hoping for the best, right? He's not popping and praying. And on average, he did 1.2 to 2 segments per visit, which is awesome. What they found was that over those 18 months, in all the different cases, they had what they looked like statistical significance, so they didn't give a p-value there, of change in both physical and mental component scores, right? And this is one of the things that we talk about. Chiropractic is not just about the physical aspect, but mental health and awareness as well. And that's where the nervous system comes in, adaptability, adapting to stress, the environment, stimuli, etc. So the first case was a 65-year-old female with hip pain who presented from a fall the following weekend. Case 2 was a 61-year-old female who presented with right shoulder pain and neck pain. Case 3 was a 63-year-old male who had neck and shoulder pain. Case 4 was a 62-year-old with low back pain. And what they found was that each patient reported on in this case series demonstrated clinically significant improvements in physical and mental health component scores, with the exception of the third case, who only demonstrated this is in the mental health component score. Oh my gosh, if you know me, you know I love this, right? Because one of the things that I talk about all the time is that we have this sect of the profession that only wants to view chiropractic as the physical effects, just treating the symptoms, just treating the musculoskeletal conditions. But the fact is that in this series, what they're publishing research on, where they have the data to actually show it, is it's not that, some improves mentally and all of them improve physically, but it's the opposite. Almost everyone improved both mentally and physically, but if you had to just choose one, the mental improvement is the greater. I absolutely love that. That makes me so happy to read. Kudos to you, Dr. Dylan Jones from New Zealand Chiropractic College, in doing something so simple, just simply taking the data that you have in front of you and turning it into an impactful paper, demonstrating the improvement in quality of life for our aging population. A lot of us are going to be able to take this and use this to further our knowledge, to increase our certainty with dealing with so many of the aging populations. For me specifically, I know with kids, they're just going to do way better because that problem hasn't been there for as long. So still knowing that even if we're not just going in there and flying sevening, moving a bunch of stuff for the sake of moving a bunch of stuff, but still being very gentle, very specific in our care, we can have huge life-altering, trajectory-changing improvements in both physical health and mental health awareness. Once again, it's Dr. Dylan Jones, changes in quality of life in 4 older adult patients receiving manual chiropractic care for the correction of vertebral subluxation, a case series, and this was published earlier this month in the Chiropractic Journal of Australia, which is a free journal, so you can go read that. All right, this next study that we're going over today is amazing. I really want you to pay attention. It's called Clinically Significant Psychological and Emotional Distress in 32% of adolescent idiopathic scoliosis patients. This is written and published in the Journal Spine Deformity. It's written by a group of MDs from the Children's Orthopedic Center at the Children's Hospital of Los Angeles. This is really important, this study right here. Somewhere between 13 to 20% of children in our country right now are diagnosed with a mental disorder or psychological disturbance. And that's really significant. It's really significant. Will continue to hear me harp on the role of subluxation, of spinal conditions, deformities, whatever you want to call it, on mental health. You'll continue to hear me harp on the role of chiropractic care on the optimal functioning of the nervous system and how that relates to mental health improvements. And you're going to continue to hear me harp on that. So if you're not okay with that, if you just want to hear about back pain and neck pain, this is not the podcast for you. But the thing is that while they don't know it, the rest of the world, and a lot of what this podcast is about isn't chiropractic research, but it's how the rest of the world, the medical doctors, orthopedists, OTs, PTs, they all know this. They just don't realize that this is what we do. So this is why papers like this are so important for us to know and to understand. Because guys, the bottom line is that if we know that things like scoliosis are related to psychological disturbances, and yes, this paper is looking at it specific to groups of observation, bracing, and surgery, the same way we learned it in school, right? When they have this degree, their observation, this degree they're bracing, this degree they're surgery, and we know through various studies that we can improve especially adolescent idiopathic scoliosis, and we've seen that, so we know that this is relating and correlated to a psychological disturbance, and if we can show that we can improve this, then oh my gosh, the indications, not just for an individual and how they're going to live and function and their happiness and their quality of life, but the overall public health implications here are huge. So this is why we need to know and understand this, right? So basically, these doctors took 3 different groups of people. They took kids from the ages of 10 to 18 years old, 17 years old, and they put them into 3 different groups. Who's going to be just observed, who's going to be braced, and who's going to need surgery. And they did these psychological questionnaires and combined them to baseline of what somebody without scoliosis would have in terms of psychological disturbance, and they looked for means and correlations. In the introduction, it says adolescents with scoliosis may exhibit a less positive outlook on life, suffer from lower self-esteem, and have more difficulty connecting with peers. So the purpose of this study is to determine if psychological problems are prevalent in patients with adolescent idiopathic scoliosis, and if differences exist between treatment groups. So they broke them into the 3 different treatment groups, which were observation, which were bracing, and which were surgery. What they did was they looked at the different subscales of a form called the BASC2, and the most clinically significant psychological disturbance that was found was in the Emotional Symptoms Index, and they described this as a global indicator of abnormal behavior and includes the subscales of social stress, anxiety, depression, sense of inadequacy, self-esteem, and self-reliance. So remember, these are teenagers that we're talking about here, and this is why I think this is huge. I don't know if you guys remember your teenage days. I try not to remember mine, but there was a lot that was going on, a lot of things physically, chemically, emotionally, hormonally that were happening within me, and many of these things that they describe, I experienced. You know, I think so many people can relate to stress, anxiety, depression, inadequacy, self-esteem, self-reliance. I mean, heck, that's the reason we do positive affirmations in the morning, because I'm not a teenager anymore, but you know, some days it's easier than others to not feel that way. And let's be real, guys, if it's hard enough as it is, if you add in something like a scoliosis, which, yeah, there's the looking at ourselves and the physical aspect of it, but we know the role of subluxation and how when there's a curve like that, it's going to put undue tension on the spinal cord and the nerves, and that's going to affect our mental health. We know that if we have those contributing factors as well, how much worse it's going to make these things. And this is exactly what they look at. What they found was an increased clinically significant psychological disturbance in 26.7% of patients with a curve of 15 to 30 degrees, 30.6 degrees for 30.6% for curves from 31 to 50 degrees, and 38.5% for curves 51 to 95, which is obviously our surgery group. So this is what they're saying: the greater the curve, the greater the psychological disturbance. But in any curvature whatsoever, we're already seeing a 27% increase in psychological disturbances specific to that emotional symptoms impact index, which is anxiety, depression, self-reliance, self-esteem, etc. Like, wow. Here's the more impactful things. They also gave a questionnaire to parents as well to see if their parents kind of knew this. And the parent scores were much lower, knowing their kids had psychological disturbances. So 60% of parents whose kids had clinically significant psychological disturbances were completely unaware. completely unaware of what their kid was going through. 2/3 of parents were completely unaware of what their kid was going through. If that doesn't fire you up today to get out into your community to talk about the role of subluxation in the quality of human life for adults, for kids, for those with scoliosis and without scoliosis, then please check your pulse. Psychological disturbances in teenagers, 66% of parents unaware. And this is what they're finding because of kids with scoliosis. So kind of keep this with you today and realize that every adjustment that you give that restores the normal curvature of the spine, yeah, that person's going to feel better. Yeah, their posture's going to improve. But if we can improve anxiety, depression, self-reliance, self-esteem in teenagers by moving vertebrae and taking tension off nerves, I mean, this is like millimeters of change here, right? If we know that we can improve these curvatures, and the more and more and more that we improve it, the less clinically significant psychological disturbance there is with every degree of curvature change, that is not only an individual life change, but every person who they impact on a daily basis. Just keep that with you today. Just know the impact that you're making on your community today, Doc. Because this isn't chiropractors writing about the role of scoliosis, of spinal curvature in mental health. This isn't chiropractors worrying about it. This is Dr. Sanders, BA. Austin Sanders, BA. Dr. Andrus, MD. Dr. Ian Torno, BA. Dr. Anita Hamilton, PhD. Dr. Paul Choi, MD. And Dr. David Skaggs, MD, with a bunch of other letters after their name that I don't know what they mean. Anyway, these guys know it. Do you? Or are you more focused on rubbing somebody's shoulders because they're in a little bit of pain instead of just correcting and unleashing the imprisoned impulse? Keep that principle with you. Thanks. All right, I'm going to click on this last study here because it's a nice little case report. I'm going to get quick right into it because I kind of rambled and went a little deep on the other two. This is revolution of lower limb neuropathy and improved physical functioning in an 18-year-old male cricketer receiving chiropractic care. A case report. If you're wondering what the heck cricket is, this is published in the Chiropractic Journal of Australia, as I mentioned earlier, is a free journal. This is from Dr. David Russell, who has to be one of the most published chiropractors outside of Dr. Joel Alcantara, Dr. Matthew Doyle, and this is awesome. Cool. Case study. So, 18-year-old, neuropathy, 2-year history of low back pain. Crazy. 18 years old. Manage him with TRT and activator. So this is all instrument adjusting. A lot of the times, when I was teaching, when I was in club with TRT in practice, the club in TRT at Life University, a lot of the people had questions that, I love the autonomic changes with torque release technique and instrument adjusting. I love that. I love the mental health changes, things like that. But can I actually help people with real problems like neck pain and back pain? And that's what a lot of people coming from this Flying 7 type model, those are the questions they had. And this just goes ahead and demonstrates this. 18 years old, 2-year history of low back pain, leg and foot pain, had pins and needles in his left calf, front and medial side of the foot, loss of strength. He was under 8 months of physical therapy, during which time the patient reported that his symptoms progressed or worsened, and the left piriformis became tighter. They did an MRI. They found L5-S1 nerve root irritation. Upon examination, he had an anterior head carriage of 4 centimeters. 4 centimeters, 18 years old. It's a lot of texting that can cause that, and a bunch of other chiropractic findings, palpation, etc. They did insight. SEMG is blown out. Looks like there's black bars through the entire cervical spine on EMG, as well as that T12 to L1 thoracolumbar junction. Start adjusting the kid. Second visit. Patient commented they were feeling better with less pain. And this is just a willy-nilly little instrument adjustment, right? Torque release technique, activator. They can't really make any change. They're not going to feel better any quickly. I want to move a bunch of stuff because I want them to feel better. Blah, 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 blah. If you're not doing physical therapy, you're doing other things in your practice, you're just blah, 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 blah. Stupid. Second visit, feeling better. Fourth visit, the most pain-free that this 18-year-old had been in ages. Continue under care, complete resolution. 18 years old, 2 years of neuropathy. Chiropractic care, not based around e-stim, not based around massage or acupuncture, not based about anything but removing nerve interference from the spine to allow the optimal performance of the individual. That is the only thing that they did. Gentle, specific, scientific chiropractic adjustments. Life completely restored. 18 years old. So please, tell me about your rehab. Tell me about your exercises. Tell me about those patients not going to get better and you're just having an ego if you don't do those things. Tell me about that, and then I'll show you the research. Thanks for listening. I'm Dr. Anthony Pellegrino from ChiroEdge. As always, we'll be back in the research breakdown next week, breaking down more clinical research for your practice, which you can use, keeping you fired up, keeping increasing your certainty. You can have information like this in digestible patient newsletter format, which essentially is written with the practice member or patient in mind, so they can use this information to refer their friends, family, coworkers, and even increase their own certainty in what you do and knowing that it's bigger than just us. With much less rambling from me because it's concise. You can have that information as well as social media posts on these these handouts and social media posts branded to your practice. You can get that at ChiroEdgeMedia.com. You can get a 2-week free trial of this service at ChiroEdgeMedia.com. Or if you just want to go and share the social media posts that are relevant to this research, you can go to Facebook.com/ChiroEdge or Instagram.com/ChiroEdge or Twitter.com/Dr. A. Pellegrino, DrAPellegrino. Or you can just check your email box. Anyway, love you guys. Appreciate you. Peace, love, tick, ChiroEdgeMedia.com.